Well, hello and welcome, everyone. I'm Raj Kumar. I'm the president and editor-in-chief of Devex, and delighted to be with an incredibly international group of leaders here today to talk about healthcare workers and their importance and their training, and to be joined by so many of you all over the world who care about this issue, who understand it so well. Thank you for being a part of today's session on whatever platform you're following us on. We are eager to hear your questions and ideas as we go forward today, because we're here to talk about what is one of the most essential issues in the world, one we knew was important before this coronavirus pandemic that we are still in the midst of all over the world. But now we know certainly the absolute importance, the centrality of healthcare workers at every level of the system, including those sometimes referred to as frontline healthcare workers, the people who come into communities and into clinics and directly interact with patients. And again, those who knew this was important always did, but this pandemic has really shown as hospitals and ICUs have been filled, as people seeking care for COVID or for other ailments have found their healthcare system stretched around the world. We have seen the absolute importance of healthcare workers. The WHO, of course, had declared last year, 2020, before this pandemic, they had said it would be the International Year of Nurses and Midwives. And they've declared this year, 2021, the International Year of Health and Care Workers. And really, we're here today to sort of put teeth on that idea. What do we actually do? How do we take the intention and the feeling we have about healthcare workers and actually make that a practical reality when it comes to things like training and funding and sustainability? And so we want to zone in with our partner organizations at GSK and Save the Children on what's working, on some solutions. And we're going to hear, in fact, today about a program that has actually scaled and trained some 30,000 healthcare workers around the world. And we're going to hear from people who are doing this work. We have a colleague joining us from Yemen who is working directly with community healthcare workers, and another joining us from Busia County in Kenya, right on the shores of Lake Victoria. Maybe we'll get some images. And really excited to hear about how this is playing out in the real world. I want to just mention briefly who are some of the people who will be part of the session today. We have Catherine Kane, who's the technical officer for the health workforce team at the WHO, Fiona Smith-Layton, who's the vice president of global health at GSK, Diana Mukami, who's the head of programs at the Institute of Capacity Development and the digital learning director. We're joined as well by Gwen Hines, who's the executive director of global programs at Save the Children. And we're going to be hearing, as I mentioned, from people who are doing this work right in their communities. Dr. Sama Mohsen, who's the Health and Nutrition Program Officer for Save the Children in Yemen, and Emmanuel Luvai, who's the County Community Health Strategy Focal Person and a member of the County Health Management Team in Busia County, Kenya. So I'm really excited to be joined by these incredible leaders, people who are doing real work that we're all going to learn from today in this session, and by all of you. So again, I welcome your tweets and your questions in the thread, and we'll try to weave them into the discussion today. And just to get us started, I'm going to ask our producers to bring on an interview that we have from my colleague, Sarah Jerving, who's a senior reporter with Devex based in Nairobi, interviewing Dr. Sama Mohsen with Save the Children in Yemen. Please, let's begin and hear that interview. Thanks for being with us.
Thank you to everyone for joining us. Today we are talking about the critical issue of supporting community health workers who play a pivotal role in many national health systems globally. So today we are joined by Sama Mohsen Ahmed, who is a health advisor for Save the Children in Yemen. So welcome, Sama. Working with community health workers is a key part of Save the Children's programming. Can you tell us a bit more about your programming around community health workers in Yemen?
Thank you. Firstly, thank you for everyone, all the supporters for this event. I'm Sama Mohsen as a health and nutrition officer, Save Children Yemen. Our work in the communities. The health community workers started work in Yemen since in August 2018 under GSK grant, and they work in six health facilities in 2 districts, Tor al-Baha and al-Madarba districts. We trained 48 community health workers full training about the communication for development, infant and young child feeding, and growth and development. The importance of this community health worker. It is work in the distance places in too far away area, which the communities cannot reach to the nearest health facility. They are maybe need about 2 hours to visit the health facilities, and at least 2 hours to walking distance, and about approximately 10 kilometers. So they are treated the children under 5 years who are suffering from the communicable disease and the fatal disease in childhood, like the pneumonia and diarrhea and malaria, which it is fatal for children.
Okay, thank you. So it sounds like it's the community health workers that you're working with play an important role in reaching hard to access communities across Yemen. How does that kind of complement the government's efforts at providing healthcare to citizens across the country?
The government should be recognizing the value of this health worker, and the Ministry of Health and Populations and the District of Health Facilities consider them as the account of the health workforce, and they are as a part of the health system and as a zest of the human health system. Because those the health worker selection from the communities, and it is like the link between the communities and the health facilities. So there is a strong relationships and friendly relationship between the community and between them and the communities. Always this community health worker needed to be a part of the health system. We exist from this district and from this governorate should be supported them to be sustainability and continuation for this work.
Okay, thank you. And could you talk a little bit about the COVID-19 pandemic in Yemen? What sort of challenges are the health workers facing with responding to the pandemic?
Firstly, the spread of this pandemic, it is considered it is a problem globally, unless this in the developing countries like Yemen, the of the knowledge and awareness and about how transmission of this disease and the acoustic agent of the disease and how to be prevention and the availability of personal protection equipment make them scarred from this pandemic. So the challenges the community health worker at first feeling is fried from this ban due to the lack of this knowledge, and we are try to solution for problem by the training the community health worker about the about positive agent of the disease, about the mode of transmission of the disease and incubation period of the disease, and how to be prevented them and their family, so that make them is more confident and more and continuation their work, and make them to do to prevent themselves and their communities.
Okay, and how is the project with GSK trying to address some of these challenges? What are some of the main lessons that you guys have learned from this project?
Okay, there are many challenges and numerous facing them, like the ongoing conflict, make their life it's very dangerous and exposes them to the numerous risks. As example, one of our community health worker named Fadia, she told me sometime during the field visit Suddenly armed clashes, and she was trapped and finally. And Fadia, she thought she will be going to die. Also, sometime during the visit, she exposed it to the attack of wild animals like dogs. And other also challenges. There are the unrealistic workload due to the number of trained and employed community health worker, and additionally about the payment and incentive are too low. So always the community health worker said wanted to be raising the payment because there are mostly of them are female, and according to the cultural and traditional communities, this male need a relative male to travel with them. So need a cost for the transportation and the food expenses. So the requirement it is for raising this payment, and we are resolve this matter by increasing the payment according to the government standard, because the community health worker they are feeling as working as the just like health worker. We are selecting this community worker near the village, locating them near to their village to facilitate the work.
And can you talk a bit about training community health workers? What are some of the challenges with training? Kind of what are, in your experiences, what are some of the most effective ways to train?
Some training is short period, and due to the budget cost, and some difficulty, some of the matters facing me like needed more in-job training and more refresher training to created the work good, and to become it is more qualified. So this some of the challenges facing me.
Okay, thank you. And we're unfortunately out of time, but I wanted to just ask in closing, is there any message that you kind of want to share on behalf of community health workers in Yemen about kind of what do they need? What more resources do they need? What sort of help do community health workers need? What is your message?
Okay, the message and the recommendation for them, the community health worker supported from the government for the sustainability and continuation of the work after the safe shelter leave it, and because they are as a zest of the health system, and they are a part of the national Yemen system, Yemen health system. So need more encourage from the government, and the government not dependent only to the safe shelter, to the another organization, and must be pushing and encourage them and support them for the continuation, because it is like the power for the Ministry of Health, because they are surface many things for the communities and the far villages. So they are needed like the monthly and regularly payment for them, and needed for the continuation for raising the education and awareness for the communities.
Okay, well, thank you so much. And as you said, the community health workers are playing an indispensable role in the health system in Yemen, and they need more support. Projects like Save the Children are working to support these community health workers and And yes, well, thank you so much for joining us, Sama. We really appreciate your input on this very important topic.
Thank you. I will express for everyone and individual supporters this great event. Thank you. Very special thanks for everyone.
Well, my thanks to my colleague Sarah, and what an honor to have Dr. Mohsen join the event today. You know, she told us the story about a community healthcare worker who thought her life was in danger in the middle of the conflict, and really these healthcare workers are heroes in Yemen. I mean, we all know the situation there. The conflict is very active. The UN warns that just this year, some 400,000 children could die of starvation. So the work that community healthcare workers are doing is right on the front lines of that very issue. And it just underlines the stakes here. I want to welcome our panelists to turn on their videos and to join our conversation, because I'd like to switch from Yemen and to hear another circumstance, to bring in my colleague Emmanuel Lavai in Busia County in Kenya. I referred before to your county. I've never been there, Manuel. I've been to Kisumu. I think you're a couple of hours away, maybe, from there on the border of Uganda and near Lake Victoria. I'm sure it's a beautiful place. Tell us a little bit about the situation where you live and work. What are the circumstances that community healthcare workers are facing right now where you work?
Thank you, Raj. As you've already introduced me, my name is Emmanuel Lavai. I'm a public health specialist working in the Republic of Kenya in a county or region called Busia, very close to Lake Victoria. We are one of the lake endemic regions as far as malaria transmission is concerned, because of the environmental conditions that are prevalent around here. The weather here is relatively warm throughout the year, fertile ground for breeding of mosquitoes. And of course, we face other many challenges, including wash-related challenges, frequent outbreaks of cholera, amongst other waterborne diseases, the heavy burden of HIV, AIDS, the rates of transmission fairly high here, prevalence quite high, but we are doing our best. And that's why we have the community health system to help augment efforts towards management and control of some of these conditions. So in Busia County, we rely heavily on community health workers. I am the coordinator and supervisor of over 2,000 community health workers based in Busia County. This is my 7th or 8th year in that role, but overall I've worked for about 15 years in the area of community health. And I think I have quite a wealth of experience working with community health workers here. The situation here is, and has been very tough since the advent of COVID-19 pandemic, way back around March 2020 for us in Kenya. Why? Because Busia County happens to be a border county, sits on the border with the Republic of Uganda. We have 2 transit corridors here on the northern highway that leads all the way from Mombasa, the port in the Indian Ocean, right through to Uganda, DRC, and many other countries around this region. So we had a problem because the initial transmission looked like was centered around long distance truck drivers. And with the lockdowns and the shutdowns of the border, the long distance truck drivers were held up in Busia County, where I am, for a very long time. And this one actively initiated community transmission of COVID-19. So we were called upon as frontline health workers to deal with that situation, to empower communities, to ensure that we create a barrier of transmission between the long distance truck drivers and the communities, and to see to it that we are safe here. But that was quite a challenge, because as my colleague from Yemen has already pointed, in the initial stages, there was very scanty information about the pandemic. We could hardly come across useful pieces of information that could help us take prompt action. Then the problems of lack of PPEs care workers could use to protect themselves, and later on stigma associated with the disease, because it looked like now, apart from the long distance truck drivers, healthcare workers were another segment that were at high risk and one of the potential spreaders of the pandemic, of the disease. So me and my community health workers were labeled as the super spreaders of the disease, and probably the community became stigmatized and restricted our movement and the interaction with them. But right now we are managing, the situation has improved fairly well, done a lot of public awareness with the available pieces of information, with the available preventive and control measures. And I think we've kept our transmission fairly low, even though the potential and the risk of transmission still persists. So we just have to keep working. We can't afford to sit on our laurels. We just have to keep engaging communities so that we manage the pandemic, Raj.
Yeah, thank you very much for that overview of what's happening where you are. It helps so much, I think, for all of us to hear how these circumstances are very real in particular places and how they connect to all of these other issues, right? The pandemic might have seemed very distant, and it came to your county in a very real way. It has so many knock-on effects. And maybe, Diana, I can bring you into the discussion here too, since you're in Kenya as well, and that's where AMREF is based. Of course, I think everybody knows AMREF is the largest indigenous African health NGO, and you work beyond Kenya. But given that you're there, I'd just love to get your perspective too on where you see health workers, like the community health workers Emmanuel is talking about, fitting into the broader strategy to improve healthcare for people across the continent of Africa and elsewhere around the world.
Absolutely. Thank you, Raj, and good evening, everyone. So I think, like Emmanuel has illustrated and shown us that the critical role that community health workers play. So we know that within this region, more than 70% of the population lives in rural areas, which means that in terms of being able to access healthcare services, there's a heavy reliance on primary healthcare providers, which includes the community health workers. So the proximity is both in terms of geography, because they are within the communities, but also in terms of culture, because they're from those communities. They understand, some of the cultural characteristics that we need to make sure we understand to provide quality healthcare services. And then when you look at the impact of the pandemic, not just in Busia, but across the region, across the world, the truth is that even prior to the pandemic, there was already inequitable access to healthcare services, and more so for disadvantaged communities. So if you think about people with a low socioeconomic status, persons with disability, women, girls, and so forth, that was already happening. And this has been made so much worse by the pandemic. And also looking at, the interruption to the other health services. So just because the pandemic is happening doesn't stop us from having malaria, like Emmanuel has described. Doesn't stop people from needing to access reproductive maternal child services. Chronic illnesses are still on the rise within this region, so people still need to access those services. And there is a critical role that community health workers play, because they serve as the link with the formal health system. There's a lot of mistrust around the health system. So community health workers who understand these issues and challenges, they provide critical health education, health promotion services to make sure that the communities are being able to access them. So when we have a challenge like the COVID-19 pandemic, and they're being seen as super spreaders of the pandemic, that actually just makes the situation so much worse. And so we want to make sure that we are recognizing and strengthening the role of community health workers around this. But there are many other factors that also we need to think about as we think about the health system in its entirety, because we've just talked about the knock-on effect that it has had across the different sectors. We cannot look at it as a standalone problem. We have to look at it in a more whole of society approach. So with the pandemic, we've learned quite a number of things. One of them is around leadership, because countries, everybody was grappling with what do you do, where do you start? So leadership from entities such as the World Health Organization at the global level, providing guidance and direction to the different countries. At the regional level, we have people like Africa CDC, and also at the national levels and subnational levels, really creating structures that allow countries to better manage the crisis that we were in. I think the role of leadership is really critical. So even as we think about continuing to battle COVID, and we think about the future, because we know the future will be filled with more and more pandemics. This is going to become
this is not the last one.
It's not the last one for sure. So how do we build in resilience into our systems? We're looking at partnership of how we can do more capacity building around preparedness and response for public health emergencies, working with the different stakeholders, and I mean across the different sectors, not just in health. So those are some of the things that we want to make sure that we are tackling, and really understanding that we need to care for the carers, make sure that these primary health care providers, like the community health workers, are also being supported, being provided with the right education and training. They had the same questions that everybody had in terms of what is COVID-19, how do I protect myself? And yet they also have the double burden of being expected to provide critical services to the community. So then who will care for this person who's providing the care that everybody is looking at them to do? So I think some of these things are the things that we want to make sure that we're addressing now and moving forward, so that we have not just equitable access to health services, but also equitable health outcomes, so that everybody is actually benefiting from the services that these community health workers are providing. So that's some of the reflections from where I sit.
Yeah, really helpful reflections there, and I see a lot of head nodding from Catherine and Fiona. But before I get to the two of you, I want to ask Gwen Hines from Save the Children, who's with us, to kind of give us a fire starter question to get us going, to just jump in. We'd love to hear what you've got for all of the panelists here, Gwen.
Thanks very much, Raj. And it's fantastic having such brilliant speakers here with their different experiences around the world. But I think what you're hearing from everybody, and what I definitely back as well, is just the vital role that community health workers can play, especially during COVID, where we saw that bottom-up community responses were the solution, whether it was in the UK, whether it's in Nairobi, everywhere around the world. And so we know they're important in crises, we know they're important to humanitarian settings, fragile states, low-income countries. And I think the challenge for all of us is, how do we therefore make this model more sustainable? Because there's so many projects and programs around the world which are backing this. When I look at innovations in health and nutrition, this is all about integrated community responses with community health workers, local people from their own community as a solution. Be that pneumonia, malnutrition, malaria, COVID, all these things, it's so important. And we're really proud of the partnership we've got with GSK, and credit to Fiona and the GSK team. We've got members of GSK around the world providing funding themselves, as well as a corporation, and together working on preventable child deaths. And just to underline, this is preventable. These are things we know how to do. So none of this is rocket science. But the question is, how do we make this sustainable? Because, as Emmanuel himself has said, it's part of the government system. But too often we get caught between a really good innovation, tiny amounts of money to community health workers, which then stop or start or become unsustainable if they aren't built into a long-term system. So I think the challenge is, how do we take this fantastic solution that we know is so vital and really turn it into something we can all rely on and build on going forwards?
Yeah, that's a great point, Gwen. And Diana mentioned it, that this is a systemic issue, right? But so often this is thought about as a project or a siloed funding stream. So there's money for a particular 1-2 year period for community health workers to work on one infectious disease. When, as Emmanuel said, these are community health workers who are part of their community, and they're there to going door to door to family visits, dealing with every health issue that someone might address. It really is a systemic problem, and everyone benefits if you can address it. But it's also hard to figure out who can jump in and address it. And that's why I'm interested to bring in Fiona from GSK and just hear more about, we think of GSK for your science, your innovation, right? Developing vaccines or therapeutics. Why are you in this business too now of helping to train healthcare workers, working with Save the Children and others? Where do you see GSK fitting in, and why is it important to you?
Brilliant. Thank you very much. And just to reflect as well on Sama's story and Emmanuel's story of the bravery of these healthcare workers out there every day and what they're facing. And we're a million miles away from them, some of us in a nice clean room. And I just want to recognise the incredible work that people are doing and massive thanks. So I agree. We are a company that's focused on innovation and science. So what is our role in healthcare worker training and programs with Save the Children and others? And I think it's three things mainly. So the first reason that we do it is because we think it's good for our business. The second reason is because we believe that we have a role to play, that all private companies have a role to play in making the world better. And the third reason is around employee engagement. So that's really where we connect it to our kind of core purpose, if you like, of driving innovation and developing new medicines and vaccines. So the first point really around it being linked to our business is it doesn't matter how much innovation there is in the world and how much brilliant malaria treatments and new vaccines can be created if the majority of people who need them haven't even got access to basic healthcare. So it is absolutely vital to us, and it's part of the overall kind of chain of these medicines and vaccines to people who need them, that actually we do our bit in strengthening the health systems. And we haven't got the expertise in that, which is why we're so proud of our partnerships with Save the Children and AMREF and others.
There's just too many examples, tragic examples of pharmaceutical companies developing great new interventions, and then they sit on a shelf somewhere because the delivery mechanism, the healthcare workers weren't trained, the supply chains aren't set up correctly. And so you wait 2 or 3 years or more before patients get access.
Yeah, and honestly, we're seeing that now a little bit with the COVID vaccines, aren't we? That, there's all sorts of things not working about the worldwide vaccination attempt, but one of them is that there isn't the capabilities at a local level to actually give them in the time that it's needed. So 100%. So it's a kind of a long-term resilience also, to build on a word that Gwen used that we do. The second reason is, of course, we believe, like many companies, that we have a role to play in improving the world, reducing inequalities, and it is the right and a good thing to do that we care about. And the third is that it really is a very strong motivator for our employees, and kind of people really care about it. And in fact, it's one of the things most strongly engaged with when we do our kind of internal communications. And one of the big sources of questions is all the things that we're doing as a company. All these people are working very hard to produce the medicines and vaccines. They're not doing that so that the company just makes lots of money and a few people get it. They're doing that because they really come to work caring about the outcome. So it's also a really great motivator for our employees. And as Gwen said, we do a lot of fundraising for our employees, and we've just been blown away this last year with how much additional people want to contribute to the healthcare worker training that we've been working on.
Yeah, no, they must understand it well, working at a place like GSK. They see the value of that. We've talked now a bit about private sector, we talked nonprofits, but government has come up a few times. So Catherine, maybe I can bring you in on this point, right? Because, Emmanuel talked about it. We heard it from Dr. Mohsen, that ultimately healthcare workers have to be connected to the government system, right? This is a systemic issue. How are you at the WHO working with governments to develop these strategies around training and supporting healthcare workers?
Sometimes I'd like to look at my role as being the chief cheerleader in WHO and maybe an international fora for community health workers. But I think it goes beyond that. So I'm going to put my WHO hat on. We are here to support our member states. We are here to provide what's called normative guidance, to look at all of the evidence around the world, look at best practices, consult the experts, and advise both member states and partners on how to approach thorny issues, as well as providing direct technical support to countries. So our approach is actually not just to say, let's add millions of community health workers, but actually to work with the government to understand what the labor market looks like, figure out where a community health worker would fit within there. So note, what I'm saying is labor market. I'm looking at these as jobs, not as volunteers, but as real jobs in communities. We take the data, we work with the government to gather data. And in fact, we have a major effort on right now that I'd like to invite everybody here to help us work on, which is to count community health workers globally. We don't have a count yet. Next year at the World Health Assembly, we are going to tell you how many community health workers we know about in the world, how they're paid, what their composition is in terms of gender, what they do, whether or not they're connected to the government, We're going to tell you that next year, and we're inviting you to join us in counting them. And then we also help governments to understand policy options and evidence. So what's really fundamental to understand here is that community health workers are trust bearers. Trust is currency. We know that right now. We know it within COVID-19 when we're asking people to do things they don't like to do. Now, for once, we're asking people in high-income countries to do things they don't like to do, wearing masks, washing our hands, not going to a party. We've been asking people in low and middle income countries to do that for years, and we've been asking them through their community health workers. How is it that we're placing this burden on people within the community, yet we're still reluctant to pay them and to look for sustainable models? So from the WHO standpoint, we work with governments to find those sustainable models, to non-verticalize programs, to look at the readiness of community health workers as part of a spectrum of interdisciplinary teams. So we are working with governments to support all the way from a CHW guideline, and thank you. I feel like everybody on this panel has read and incorporated it. This is one of the greatest commitments I've seen in my career with WHO. We took the Declaration of Astana. We stood there 3 years ago in 2018 and said, we believe that community health workers are part of providing primary health care in communities. So let's go a step further. Let's bring in a lot of the elements that have already been mentioned here, and let's ensure that we're investing in community health workers, that we are investing in decent working conditions, that we're investing in education, that we're investing in career opportunities. Our job with WHO is to make that investment case. When you pay and support and train and invest in the career development of a community health worker, you're not getting health services in a community. You're getting real jobs for women, for young people, for people from disadvantaged situations, from marginalized groups. You're getting jobs. You're providing support to education. Why do we educate our girls? Well, so that they can keep your community safe. We're getting labor dividends. So when you invest in a community health worker, often she, and I use that word very deliberately, over 7 in 10 health workers globally are female. That increases the closer you come to patient care. When we pay a community health worker in a community, she reinvests that in her children's education. She reinvests that in buying vegetables from her neighbor. She reinvests that in caring for her parents. So we are investing in equity. We're investing in labor. We're investing in education. We are investing in the human beings who are making sure that we're healthy and building our resilience. I'll stop there, but I've got so much more to say.
No, we can see the passion, and I love the way you're framing it because it's so important to think of this. You said a few things. You talked about it as a labor market issue, and you talked about the investment case, right? And you could see someone saying, "Well, why train a healthcare worker, a community healthcare worker, if really it's just a volunteer job, and if they're not committed to this?" But you're explaining the correct way. I think that if you position community healthcare workers as part of the system, then of course you would want to train and invest. And because this is not for a vertical program, it's not for a one-off project. This is part of the national system that is there to support whatever the next pandemic is, as Diana said. So it is a framing issue that is so important. And the fact that we can't count the number of community healthcare workers points to sort of how things have been framed in the past, right? Which is, this is not as important. This is a segment of the health system that's kind of off to the side, that's volunteer, that's not sustainable. And so we do need a reimagination, I think. And that's why programs like the one you're talking about, Fiona and Gwen and others, where you're actually investing in training, starts to shift the thinking about how these healthcare workers fit into the broader system. I want to open this up to everyone here for your thoughts and comments. There's so many good ideas that have been brought to the table already. Who wants to jump in? Fiona, anything to add to what Catherine has said? Or go ahead, Diana.
I was just going to say that, I mean, this is, I think, preaching to the converted. And when you think about the community health worker, there are a number of reasons why people seek access to health services or not. Some of them include, first of all, the decision to actually seek for the service. How do you know whether you need to go? And that's where the health education, health promotion aspect, that's the most critical aspect, because every individual is responsible for their own healthcare. So the community health worker then plays that first role of making sure that communities understand what health is, the social determinants of health, why it's important for them to seek those services. So without that, even whatever companies like GSK produce, then nobody's going to use them. So that first step of making that decision to seek care is really important, and the community health workers plays such a critical role in that. Then there's a second part about can they then access a health facility, the primary healthcare facilities, which are close to them, and therefore there are factors to do with economics. What's the cost of getting there? What's the distance? Can I afford it? And many other factors in terms of actually reaching the facility. Is it even there in the first place? So that again, looking at partnerships to make sure that we're finding models that can allow communities to then actually access in terms of reaching the facility. And then finally, when they get to those health facilities, do they have the healthcare professionals in them? Are they trained? Do they have the right information? Do they have the right equipment and medication and so forth? And therefore, again, this is a problem that cannot be solved. It's not a one-person problem. I think it's, like we said, it's a very complex problem that needs to be addressed by private sector, government, philanthropists. Everybody needs to come in, and good health is good economics. So we see, as an organization, as AMREF, we see the critical role that strategic partnerships play. Everybody has a role to play in this. I mean, this is life. None of us is getting out of it alive. So how can we work together to make sure that we're building something, we're protecting ourselves, protecting the communities that we work with, and how can we use this critical resource of community health workers, who I think we've all agreed that we do need them. I've not been somewhere where people have said, no, we don't need community health workers. A medical doctor cannot do what a community health worker can do. And a community health worker cannot do what a medical doctor or a nurse can do. So we need all of these different pieces to fit into the puzzle of solving some of the challenges within the health system. So I'm in complete agreement with Catherine and everybody else's sentiments about needing to rethink, reimagine this challenge. And the pandemic has shown us that so many things that we did not think were possible are now possible. Different sectors are working together. We're leveraging technology more and more, and we've seen that it can help us to increase access to training and service delivery. We're working with partners who maybe were not going to be there, had it not been for the pandemic. We're looking at this as a global problem, and therefore really looking at building global resilience, because we know that no one is safe until we're all safe. So I think it's, work for all of us.
Fiona, I can see you wanting to jump in. Please do.
No, I think I'm just sort of half enthusiastic by how much I agree with everyone. But I particularly resonated, Catherine, your words around the professionalisation of the healthcare workers as a job and being properly recognised and properly remunerated. And it just made me reflect a bit on, therefore, what the role of private sector investment and programmes such as the one that we've got with Save the Children is. And I think one way of looking at it is it could be almost like a catalyst, a kickstarter for starting to get that investment, to building up, to showing the value of having a trained army of healthcare workers out there supporting the local community. But with success, very much that it becomes then embedded in the local government's priorities, that the government funds it, that the county absorbs it into their kind of ecosystem. Because as we've also said throughout this call, it's around the systemic issues and the place it has in the system. So there's lots of examples actually through the 10 years that we've been working with Save the Children, where we've been working on programs, the program started and been funded by us, but then it has lived beyond us. And I think one that springs to mind is in Mali, where recently the government has agreed to take over the payment for all the healthcare workers that we trained, and also to expand it to even greater regions. So I think that is success, that that it's a catalyst, but actually it becomes part of the system.
Yeah, you've trained some, you and Save the Children have trained some 30,000 healthcare workers since 2011. So it's a significant scale. And you think about that training paying dividends over many, many years, but you're right, it's still a tiny component of the healthcare worker gap of 18 million that's predicted by 2030. So you need to somehow turn this wheel into, the investment case, as Catherine said, so there's some positive loop. Because, I've talked to community health workers, and the things that they tell you about their challenges are so basic, right? Who's going to pay for their transportation to get to a community where they have to serve patients? Or who's going to pay the cell phone bill? They need credits on their cell phone. Or maybe they were given an app for one particular vertical program, but they don't have another for recording nutrition information or something. So it's very basic things. And you have this army of people willing and able to go out there and do this work, often dangerous work. I mean, these are real heroes in many places around the world. And yet somehow the system hasn't been built to bring them in. And maybe, Emmanuel, this is a good point to hear your reflections on how you're grappling with some of these very challenges you've heard Catherine and Fiona and Diana bring up so far.
Yeah, precisely, Raj. For Busia, the situation isn't different. First of all, I would like to bring to your attention some historical perspective from where we began, because initially we had some resistance, even from the formal healthcare workers, especially when introduced an aspect of task shifting of certain roles and responsibilities to community health workers. For example, the management of malaria, especially uncomplicated malaria. We had to bring on board community health workers to undertake this. There was a lot of resistance across the board in that people are saying the community health worker cannot manage commodities, they cannot manage drugs, medicines, they'll overprescribe, they'll underprescribe, they'll cause resistance across the board, and this will bring more problems. But I'm glad policy directions were very clear that this is the way to go. Let's CHWs treat malaria at the household level. Now, the interesting scenario is that there is wide acceptance across the board that they are able to do this, especially in Busia County, because all the 2,000 community health workers we have spread across all the villages have been trained in management of malaria at the community level. So this is a task that has already been shifted. The net result is that we are seeing reduced workload at the health facility, and healthcare workers are very much in support now of community health workers doing and undertaking that task. Further to this, we have also seen a reduction in admissions because of complicated malaria, the one that would generally maybe lead to even death or disability of a patient. These cases have drastically reduced, and healthcare workers are in full praise of this task having been shifted. Unfortunately,
this is because the community healthcare workers are catching the malaria case much earlier, right? They're
exactly.
So it gets into this kind of prevention and early treatment, early detection that they can do given their role.
Before it complicates. Now, what is now happening is that we are shifting more and more tasks to the community health worker. Unfortunately, this again bringing out another ugly scenario in that there is increased workload to the community health worker at that level. They are doing tracking for non-communicable diseases, patients on diabetes and hypertension. They are doing tracking for patients on tuberculosis program. They are following up patients on HIV management. They are following up pregnant women across the villages, tracking them and linking them to care. And we believe this is sooner going to wear down our CHWs. That's why we have brought in an element of advocacy. This is precisely where I come to answer your question, Raj, that what is Busia County doing to support community health workers and to see to it that community health services are up there and vibrant. We've taken it upon ourselves and our partners to do that bit of advocacy with the county government to formally recognize this structure as part and parcel of the formal healthcare system. Because it has been that it is the NGOs, the non-state actors, who have had a lion's share of supporting community health workers, and this is not sustainable. So we ask the county government, can you take on board this critical component of the healthcare system? Can you do that bit of payment of incentives for them? Can you shoulder a little bit of the burden of the commodities they require, the kind of PPEs they need? Can we just do so much more for CHWs in Busia County? And I'm glad they have come to realize this is very true. Fortunately, as Diana already pointed out, these are community members. Some of them are actually voters for the politicians down there in the villages. When it came to that bit of legislation, we found it very possible to have it in place, and I'm glad we are making strides. We are almost having an act of the county assembly formally recognizing community health workers in Busia and willing to pay them a monthly stipend so that they ensure that they are highly motivated, and further to ensure that they are well equipped to handle this critical responsibility. and further to ensure that we are also doing a lot of capacity building. Our colleague in Yemen already pointed out this as a challenge, that they are in some instances inadequately trained. A 1-week training, a 3-week training, what would generally take a healthcare worker, former healthcare worker, upwards of 3 years at the Kenya Medical Training College, has to be crystallized into a 3-week training for the community health worker. This could be quite difficult for them to comprehend. They come from diverse educational backgrounds. And you have to play that delicate balance to ensure that they get something at the end of the day and support the communities. So I think with increased advocacy and partnerships towards this end, we'll get somewhere for sure, right? That would be my contribution at this point from
I love that optimistic message. And I'll just add to it technology, right? And the ability to bring diagnostics or to bring the ability to have additional content information right in the hands of the healthcare worker. If we think of them connected to an automation agenda, not separate, I think there's huge potential for that. We did have a question from one of the people following along that relates a lot to what you just said, Emmanuel, which is to be thinking about, are we burning out these healthcare workers? Are we creating, mental health stress, especially during the pandemic, where they're responsible for so many things? They're asked to do this work with limited resources. I think it's an important point to raise here, to not just think we can put more and more burden on them without ensuring the right resources are there, including mental health resources. Yeah. We also had a question that came in, and maybe it's a good chance to bring it to all of you. But just thinking about how do we get all the various programs that exist, these vertical programs, and get it down to like a single tool, a mobile phone. How do you get vertical funding, which is the reality of the global health architecture we all live in? There are key issues like malaria that will have its own funding stream. And someone in fact asked Catherine about how even within the WHO, are you integrating these strategies, let's say for combating malaria, with building the health system, including the workforce? So how do we think about this idea of unifying at the level of the tool, the mobile phone and the applications, at the level of institutions like WHO and national strategies around particular infectious disease areas and others? How do we think about that unification question? Anybody want to tackle that? Maybe Catherine, I can go to you.
Well, I think you pointed to what, when I was planning with the US government, we called whole of society engagement. One of the really fundamental elements, though, is to understand that this is a team. Not one of us here is an individual actor. Not one of the organizations here is an individual actor. When you bring support to the Ministry of Health in each country, or to the Department of Health, depending on your context, when you bring that support and allow them to convene stakeholders, you allow the Ministry of Health to design sustainable programs and to centralize learning and knowledge sharing and education and resources, instead of putting it in different programs. Now, when you ask if I work with the malaria program, absolutely. I actually come from the malaria program. But I recently worked with the HIV program to look at a community health worker role within HIV, TB, and malaria. We've got some nice new guidance. Anybody looking for a nice implementation guide? Gotcha there. But what I'd like to say is that for WHO, it is central to bring all of that unity of effort under the leadership of the ministry, so that you haven't got one NGO paying community health workers $1 a day and another paying 20, tilting towards malaria programs. So when you bring all of the stakeholders together, when we join our hands, we're all going to be stronger together. I'd say you mentioned our 18 million health worker gap. And it's a growth field. Every single place around the world, health workers are a growth field. What we're experiencing now, attrition, infections, deaths, striking, because we're not providing decent work and working with health worker organizations and for health worker organizations. We need to bring everybody together. We need to bring integrated teams. Emmanuel, thank you so much for making that point about how health workers of different occupational groups accepted community health workers. In my mind, if another health worker can do something that allows me to perform to the highest level of my competencies and certifications, that's great. I owe them the supervision. I owe them a fair and balanced workload. I owe them a fair pay. I don't need to give them a t-shirt. I don't work for a t-shirt, so I shouldn't expect somebody else to. So let's start looking at how we value every human being as part of the process, where we leverage all of our efforts to come together, where we work with government to bring forward stakeholders. And if you'll allow me this 1 minute, International Year of Health and Care Workers, that is all of us. That's you. I'm going to put a link in the discussion, and I hope that all of you will go look at the call to action, figure out where you can join the International Year of Health and Care Workers. Our 5 goals: vaccine equity. Health and care workers who are patient-facing and at the greatest risk should be prioritized in every country. Recognizing and commemorating health and care workers who have lost their lives, better counting infections and deaths, better data. Mobilizing commitment for the readiness, education, and learning of health and care workers. Signing a global care compact for fair and decent working conditions. How would we not? These are people who literally give their lives for us. We don't owe them applause. We owe them decent working conditions. We owe them our solidarity. We owe them wearing a mask in public or stopping our parties for a couple more months to get us out of this. And we owe this our unity of effort, bringing together all actors in solidarity. Back to you.
Yeah, thank you for that, Catherine. And I hear the passion, and we need that, because there's no way you get past this systemic challenge if we don't bring, as Emmanuel said, this advocacy to it, right? It isn't purely a technical question. There is a political question here. There is a question about how we change attitudes and narratives and framing of this issue if you want to get somewhere. We're just down to a few minutes left. We've had a lot of great questions that have come in, and I think we've all kind of woven them into your answers. But I want to make sure each of you has a chance to give us some closing thoughts as we've gotten to this point in the discussion. Maybe Fiona, can I go to you?
I think this is one of the few areas where there is such huge alignment between public, private, government sectors. There's real, we could all sign up to exactly the same charter. There's a real power behind it now at the Year of the Healthcare Worker. I'm really excited about the possibility for making things better. And, in some ways, the focus on COVID of the world has made us realize how important this is. So I'm just looking forward to this continuing in a much more unified way. So thank you.
Thank you. And Diana?
Just to say that we just come off, we're just finishing a research that is commissioned by GSK in terms of understanding the impact or the effect of having community health workers in terms of access to equitable access and equitable outcomes in health. And more, look out for the paper. I think more and more we'll see, this is demonstrated why this is so important. And to the question of how do we make it happen with so many different factors to consider, I think for me, just to add to the discussion, is using a human-centered design. So starting with the why. Why are we doing this? What is it that we want to achieve? And therefore having the human being, the community, the health worker at the center of whatever we develop, so that we do not overwhelm them with so many things. The same human being who has malaria is the same human being who can have COVID and so forth. So how do we think about this problem from a human-centered design, and then create and continue implementing partnerships with the private sector like GSK and so forth, to make sure that we are finding solutions that are sustainable and that we're all contributing we're contributing to the solution as opposed to contributing to the problem. Thank you.
That's such an important point, Diana, because I feel like community health workers are often seen as an instrument, a tool that's out there in the community, and someone sitting in Washington, D.C., like where I am, can design a program and a plan and say, well, we'll have community healthcare workers deliver it. And to Catherine's point, we'll put a certain amount of money behind that. And really, they're not meant to be a tool or an instrument for someone's project. They're meant to be part of the health system. And you need to talk to them first to see what are their needs and how can they best serve in that community. Emmanuel, a final thought from you before we close.
On my part, as a frontline healthcare worker working in regional government, the county government of Busia, first of all, I would like to register my sincere appreciation to our non-state actors, the NGOs and other partners who've come on board to help us, even at our level of service delivery, at our level of healthcare provision, because we've had challenges since the advent of devolved health system in Kenya in the year 2013. Lots of things to do, lots of structures to put in place. Were it not for non-state actors, who would not have come this far, would not have registered any score. But I really want to laud their involvement, their engagement, their advocacy role, especially in terms of community health system. They need to strengthen that level of care and the support they have also accorded to us. I am really very grateful and very thankful. And I would need and ask that, can we strengthen this relationship, this partnership, so that we continue knocking on the political doors to wake up to the realization that they have a role to play, they have the resources to devolve further into community health system, and to give us the necessary support so that at the end of the day, we realize healthier and more empowered communities. That is what I would talk about at this moment, Raj. Yeah.
Thank you so much for those sentiments, Emmanuel, and I couldn't agree more. You know, this is an issue that we can't talk about enough, we can't cover enough. It's pretty fundamental. We've all known that, and then this pandemic comes, and boy, if we can't wake up from this to realize the centrality of healthcare workers of all kinds, you know, community healthcare workers and others, the entire network and system of health workers, and that it's a system that has to be strengthened, not just when there's a crisis, but all the time, right? Because otherwise, if you wait for that crisis, you will, you know, everyone, including that community and those workers, will face the brunt of it. So it's just fantastic to hear your voices on this issue and to hear about the impressive, committed work that you're all doing. I want to thank GSK. I want to thank Save the Children. It's a real milestone. 30,000 healthcare workers trained is something to be extremely proud of. And hopefully it does point in the direction of where we can go. It's been a real honor to be with all of you, including those who have joined and asked questions. Again, this is a topic we'll keep covering here at Devex, and we look forward to continue our relationship with all of you. So thanks so much.
Thank you.